plans.
And you at 7, Congressman Joseph Gao joins us live now from Washington. Good morning, Congressman.
Good morning. How are you doing today?
Very good, sir. Is there anything about this plan you can sink your teeth into?
First of all, I thought it was a very good speech, and it was an inspiring speech. But at the same time, I like the fact that the president emphasized no federal funding for abortion and also tort reform. The question here is, what will the final bill is going to look like? At this point, there are about 4 or 5 versions still floating around, and as he said last night, the details will have to be ironed out. And I hope that at the end of the day, we will have a bill that everyone can be comfortable and support.
And Congressman, the plan that was laid out last night that does still call for the government-run option, that public option that so many people have cried out about, is that something that you will support?
I'm just looking at for the right solution for the American people. Whether or not the right solution includes the public option or not, I still have to wait and see. But as of last night, the president opened the door for not having the public option in the final bill. I'm not ideologically against the public option. I believe that if it works for the American people, then I will support it. We just have to see what the final bill is going to look like.
What are your concerns about public options, sir?
Obviously, my concerns for public option is whether or not it will address the cost of medical care, how it will affect, for example, coverage for the uninsured, how it will affect small businesses. So all those issues I have concern with.
And what do you make of the hundreds of billions of dollars in cuts the president talked about as it refers to Medicare?
Also, that has been one of my concerns. Obviously, he's going to focus on wasteful spending in the Medicare and Medicaid program. But based on some of the experts that I have spoken to, whether or not there are actually $500 billion worth of waste in those 2 programs, we just have to see. But then again, we have to find ways to cut medical costs, and I hope that it will not come out from benefits to the elderly.
Congressman, of the 4 or 5 plans that are out there, is there any one of them that you're leaning toward?
At the moment, no. The only ones that I have read are the ones that came through the House. I've not had a chance to read the Senate versions of the bill, but based on my understanding, a lot of the provisions are the same. And at this point, I'm open to all available options. I'm just looking for the right solutions for the American people.
Okay, so it sounds like that you're really not ready to commit to any of the versions out there, any of the plans, not exactly what the president said last night. Do you foresee there being health care reform passed?
I hope that there will be health care reform passed. I believe that as leaders of this country, we have to make the hard decisions and we have to make the right decisions. And I hope that we can come together in a bipartisan way to reach an agreement on a bill that the American people can be comfortable with.
Is Republican leadership sitting down and talking with some of the Democratic leaders on some of these bills to try and find some middle ground?
In the Senate, yes. In the House, it's hard to say. Basically, the Republican leadership have been left out of any conversation in the House. I hope that after the president's speech last night, that there will be more openness in the House side of the U.S. Congress.
All right. Representative Joseph Gao, thanks for joining us this morning. We appreciate your input.
Thank you very much.